Hi, I'm Dr. Syed Nazir Mahmood. I am a pulmonary and critical care provider here at Bay Health in Dover, Delaware. COPD is a group of lung conditions that lead to airflow issues. The most common types are emphysema and chronic bronchitis. The only way to diagnose COPD is through spirometry. Normally what we do is a pulmonary function test where you sit in a glass booth, breathe in and out through a tube, and that will give me information about how good is your lung with filling up with air, how good is your lung at pushing air out, and how good is your lung at absorbing oxygen. Using that test, I have a diagnosis of whether you have COPD or not. No other test can give me a diagnosis, but can give me an idea that you might have COPD. COPD is a combination of environmental factors and genetic factors. Some people are more predisposed than others. When it comes to environment, smoking is one of the biggest issues. You may be living in an area where you have a wood-burning stove and you don't have very good ventilation, which can be another issue. And then there are other things such as pneumonias, recurrent pneumonias, childhood illnesses that can contribute, as well as some enzyme deficiencies. Over 11 million people in the United States have been diagnosed with COPD, and COPD by itself is a significant cause of death in the United States. When you are seen by a provider, we take all of your information and look at it in conjunction. One part is how severe is your degree of obstruction based on the pulmonary function test, along with how are you doing clinically, how quickly do you get short of breath. With that information, we can then determine if you need inhalers or not. Most patients will need some kind of a maintenance inhaler to stabilize lung function. The one thing I would like patients to know about COPD is that it can be managed. We first have to make sure that we catch it early enough. And part of that is being attuned to your body, noticing if you're getting more short of breath as compared to people around you. And if you are a smoker or have some of these risk factors, getting checked out early. Once you do get diagnosed, if you do have COPD, getting started on an inhaler regimen, stopping smoking, those are going to be cornerstones for your therapy.